Welcome, and thank you for taking the time to join this webinar on meaningful use and the MTBC October project. We've announced that time is running out, and it really is, to earn your full Medicare meaningful use incentive. This webinar today is going to explain how to earn your meaningful use incentive for Medicare before it's too late. There's a deadline that's approaching to earn the full incentive, and it's this October. So in this webinar, we're going to talk about how to determine eligibility, how to get started, what exactly do you have to do, and when should you start. Before we get into the details of the webinar and all of the slides that we have prepared for you today, let me first begin by telling you that you've joined the session on the GoToWebinar service. The GoToWebinar service allows you to ask questions using the GoToWebinar panel on the right-hand side of your screen. If you need to minimize your panel or get it out of the way, use the orange arrow that's pointing to the right-hand side of the screen. This is going to minimize the panel and allow you to see as much of the slides as possible. If you want to ask a question at any time, there's a questions section of the GoToWebinar service. Open up the questions section, enter your question, and go ahead and submit it. We'll try our best to answer all of your questions at the time that they're asked or at the end of this session when there's time for questions and answers. If we're not able to get to your question during this webinar, we'll respond to you by email and try to cover everybody's questions that they have. Let me begin first by introducing myself. My name is Mohammed Shibli. I'm the Vice President of Information Technology here at MTBC, and my primary role in the company is to provide the delivery, design, and implementation of our software services to our clients. And I lead the team that's responsible for the EHR. And that's primarily what we'll be talking about today. And that's what's the scope for meaningful use. To tell you a little bit about MTBC, we've been in business since 1999. And we have clients in about 35 unique specialties in 43 states across the country. We have more than 1,200 employees, and we have a 24/7 operation that allows 24/7 technical support as well for any of our services or software. For the last 3 years, we've been a Deloitte Technology Fast 500 company, which means we're one of the fastest growing companies in the country. And specifically when it comes to healthcare, we're one of the fastest growing companies in our sector. We're a Microsoft certified partner. We're an Inc. 500 5000 company for the last 2 years. All of our software and all of our services are SureScripts certified for all of their services that SureScripts offers. This is for e-prescribing, and it allows our company and all of our applications, from the EHR to our website to iPhone and Android apps, to send prescriptions to more than 65,000 pharmacies across the country. All of our EHR applications are ONC certified, which means that they're going to help you achieve meaningful use. Let's go ahead and get started in the details talking about what is meaningful use. I'm sure any provider in the healthcare space has heard this term repeatedly for the last many years. Well, meaningful use is part of the American Recovery and Reinvestment Act of 2009 and has 3 main components, primarily to help providers use and begin using a fully certified electronic health record software. The idea behind that is to improve the delivery of care within a practice. The meaningful use incentive is designed to help you use an EHR, not just so that you're away from paper, but to actually improve your delivery of care with your patients, so that you're using technology to generate drug alerts, and that's why e-prescribing is one of the most important parts of meaningful use, but also to exchange information with other healthcare providers, and to submit clinical quality and other measures to the government or other authorized agencies. That's all together part of meaningful use. Earning meaningful use requires physicians, depending on their specialty, to meet a minimum set of requirements, 15 core or mandatory requirements, and 10 menu requirements, of which a provider has to choose 5. And these payments started in 2011. We're going to talk about the schedule for those payments in just a few minutes. There are 3 distinct stages of meaningful use. The first one began in 2011, and we're actually still in stage 1. Stage 1 of meaningful use asks providers to begin compiling health information, bringing it into a discrete data format. So rather than typing in, let's say, Microsoft Word, for example, the allergies and vitals and medications of a patient in a long document, or using a transcription service, the first stage of meaningful use asks providers to pull together and enter data into discrete data fields. So that if I want to enter allergies, I'll be entering allergies in a specific section of a chart. And that I can later go on and search for those types of allergies throughout my entire practice. So stage one is really just collecting the information, capturing it, and then testing interoperability connections. So when I say test interoperability connections, I mean the software should attempt to connect to a personal health record, or attempt to connect to disease reporting with the CDC, or attempt to submit immunization registry information. That's all part of stage one. Stage two dramatically expands on that by not just requiring testing of those interoperability connections, but actually proving that they continue to be used. And in addition to that, it expands more on care coordination, which is asking providers to work together, submitting summaries from one provider to the other, sending referrals from one provider to the other. This type of care coordination across specialty and outside of your office is going to be an important part of stage two. And stage two rule has recently been released back in February, and we have those details, and we'll be providing more webinars on stage two as it approaches. Stage three is going to expand more on stage two and require more detailed clinical decision support rules, patient access to self-management tools, and comprehensive patient data analysis to help improve the delivery of public health services. Now, the deadline that's fast approaching is for Medicare, and Medicare specifically has a very nice set of incentives that are available for providers. These incentives include payments that started in 2011. Providers who begin this year in 2012 can still earn the full Medicare Meaningful Use incentive. But delaying past 2012, if you were to begin in 2013, for example, your incentive is going to be reduced to a total incentive of $39,000. Providers who begin in 2014 will have the lowest incentive of all of $24,000. And any providers that begin after that time will actually be subject to penalties. There are Medicare reimbursement penalties for non-participation with the meaningful use programs. These begin in 2015. So 2014 is actually the last year to start. Beginning in 2015, there's a 1% reduction of Medicare reimbursement, and thereafter it increases by 1% each year up until 5% beyond 2017. So it's important that not only is meaningful use an incentive, but it's a carrot and a stick. So providers are really urged to begin meaningful use as early as possible, not only to qualify for the full incentive, but to be 100% certain that by the time that these sticks are then in place, or the reimbursement deductions are in place, that providers don't suffer those consequences. The Medicaid program also offers a very nice set of incentives for providers. And for Medicaid, there's no penalty for starting later, but the requirements for Medicaid are a bit stricter than those for Medicare. The Medicare incentives apply to any provider who accepts Medicare payments. There's no minimum number of payments or no minimum amount of payments to be accepted for Medicare, but the full payment compensation is based on your total collections from Medicare on an annual basis. Medicaid, however, is not based on your total compensation, but the total percentage of your patients who are covered by Medicaid. For pediatricians, or for pediatricians specifically, the requirement is not 30% of your patients, but 20%. And here for Medicaid, you can begin as late as 2016 and still earn the full $63,000 incentive. That incentive is paid over 5 years, with the first payment being $21,250 on the first year that you begin your Medicaid attestation. The difference between Medicare and Medicaid is that Medicaid is state-based and it's managed by your local states. So the registration for both programs does happen through the same website, the EHR incentive page on the Medicare website. You have to register on that website if you're participating in Medicare or in Medicaid. But the difference with the Medicaid is after you've registered, all of the administration is then handled on a state-based level. So your local state will have an agency that handles your Medicaid incentive. There are no penalties for not adopting an EHR with the Medicaid program. So for providers that don't actually begin after even 2016, there are no reductions in Medicaid payments. The government in this scenario wanted to give an incentive for providers without including the stick or the same type of stick that they've included in the Medicare program. So the first year of actual Medicaid meaningful use simply asks you to adopt an EMR. It doesn't require you to begin using it until your second year. So adopting, installing, and implementing an EMR, whether it's a purchase or part of a service that you're already receiving, that will make you available or eligible, I should say, for the first year Medicaid payment. Let's take a look at some other important dates when it comes to the Medicare program. In the fall of 2010, the certified EHR technology became available, and at that time, vendors like MTBC became certified with testing agencies for our EHR. We had to go through a very rigorous test to make sure that our software meets the meaningful use requirements. In the winter of 2011, in January, in fact, the registration began. That was when the first time providers could begin registering for the Medicare and Medicaid program. Attestation began in April. One thing that you should know about the Meaningful Use program for Medicare is that it requires in your first year a 90-day meaningful use period, your reporting period as it's called. So even though registration began in January, providers had to actually be users of an EHR so that they can begin attesting for those payments by April. And in May, the EHR incentive payments began. And MTBC, I'm glad to report, we were one of the first companies that had providers earn their meaningful use incentive very early on. In the fall of 2011, that was the last time for providers to register. November was the last day for hospitals and critical access hospitals. They're divided into two categories in the Medicare and Medicaid plans. That November was the last day that they could be eligible to receive and attest, to register and attest to receive those payments. Now the date of this October project, as we're calling it at MTBC, the most important date to remember is October 3rd. It's the last day to begin your 90-day reporting period. Taking a look a little bit farther down the timeline, 2014 is the last year to initiate your participation in the Medicare EHR incentive program. After that, the payment adjustments begin. And in 2016 would be the last year to actually receive payments through the Medicare program. And it would be the last year to start the Medicaid program as well. So this program does have a shelf life, and it is important to begin as early as possible to qualify for as much of the incentive as you can. Let's continue on. So as we mentioned, October 3rd is that date that is the most important, because that's the time that your 90-day reporting period should begin in order to qualify for the full incentive. If you start on October 3rd, you can actually meet your full 90-day reporting period by December 31st. But a lot of things need to happen before you start on October 3rd, and we're going to be going through those items that need to be completed before that reporting period starts. If you say that I'm going to wait until September or October to begin using an EMR, you might be putting yourself at a slight risk. What if by October 3rd you're not fully up and running? Or what if the service or the vendor that you've chosen hasn't completed all of the necessary work with you to get started? What if you haven't purchased any hardware that you might need? These questions should be answered well before your 90-day reporting period begins. And that's why you see this October project that MTBC is launching is going to focus very heavily on getting providers started right now and completing the tasks that are necessary to install, implement, train, configure, and actually begin using the EHR well before the October 3rd final day of reporting. Let's talk a little bit about meaningful use in general. As we said, there are a series of core, which are mandatory requirements, and menu requirements of which you have to choose in order to become a meaningful user of an EMR. There are 15 mandatory requirements and 10 menu requirements or optional requirements of which you have to choose 5. These together are going to make you a meaningful user. Let's go ahead and take a look at some of these requirements. Some of these requirements for meaningful use include things like recording the patient demographics. And here, for this meaningful use requirement, you need to record more than 50% of your patient's demographic data in a structured format. Now, you might say, well, I'm already recording demographics, but this specific requirement asks you to record the sex, race, ethnicity, date of birth, and preferred language of your patients. So for 50% of your patients, this should be documented in discrete data format in their record. What's great about the MTBC EHR is that these items can be made mandatory for your front desk to complete at the time of registering the patient. The next item requires you to record vital signs and chart the changes in the growth, weight, and height of a patient over time. Here, more than 50% of your patients who are 2 years of age or older should have the height, weight, and blood pressure recorded as structured data. Now, there are some providers who might say, well, I don't always record blood pressure of all of my patients. It's not important for my specialty. Providers can apply for exclusions of these mandatory requirements if the provider believes that they are not central or critical to their care or their specialty. Providers should also maintain an up-to-date problem list of current and active diagnoses for their patients. And more than 80% of patients should have at least one entry recorded as structured data. You should also maintain an active medication list. This active medication list should be included for 80% of your patients. So 80% of your patients should have at least one entry of a medication documented. You should also maintain an active medication allergy list. And here again, more than 80% of your patients should have at least one medication or an indication of no allergies documented in structured data format. The next one asks you to record the smoking status of your patients aged 13 years or older. And here, for more than 50% of your patients 13 years or older, you should have smoking status recorded as structured data. The next one requires for individual professionals to provide patients with clinical summaries for each office visit. Here, a clinical summary can be the final note that's generated at the end of the visit, detailing the patient's allergies, medications, vital sign information, lab results, and so on. Here, the clinical summaries should be provided for more than 50% of all office visits within 3 business days if your patients request a copy of that. And more than 50% of all, for the hospital side, it's more than 50% of all patients who are discharged from the inpatient department or emergency department should have, or who request a copy of their medical record should have that information provided. Continuing on with the core requirements, if a patient, provide patients with an electronic copy of their health information, including the lab test results, problem list, and so on, again, for more than 50% of your patients should have a copy of that information. The next one, and you'll find that many of these are related to medication. You'll see this as a recurring theme throughout meaningful use, whether the core or the menu requirements. E-prescribing is a vital part of meaningful use. Here they're asking you to generate and transmit permissible prescriptions electronically. More than 40% of your prescriptions that are entered should be electronically submitted. And that's going to go through the SureScript service that I mentioned earlier. The next one is about computer provider order entry for medications. So if 40% of your prescriptions have to be submitted electronically, at least 30% of your patients should have one medication entered on their medication list or an indication that there are no active medications. The difference between these two items is that the first one asks for all of the submitted or actually prescribed medications, where the second one is just is also talking about medications that are ordered or entered on the patient's list. So if you're documenting a patient's active medications, that's part of CPOE. The next item talks about implementing drug-to-drug and drug-to-allergy interaction checks. This functionality should be enabled for the entire reporting period. So throughout the time that you're using the EHR, it should provide you drug-to-drug and drug-to-allergy warnings against any medications or allergies that you enter. The next step is to implement the capability to electronically exchange key clinical information among providers and patient-authorized entities. Here, the measure is very interesting because it asks you to perform at least one test of the EHR's capacity to electronically exchange information. If you remember when I was discussing earlier about stage one is where we're going to talk about testing the functionality for electronic exchange of information. So in the stage one of meaningful use, you don't have to actually be submitting on a daily basis to a local health information exchange or an HIE. But here for stage one, to qualify for the meaningful use incentive, you have to perform at least one test of that functionality. And that test can be successful or it can fail. And on either scenario, you've performed that test, and Medicare and Medicaid will both approve that as a test of that functionality. The next one is to implement one clinical decision support rule and the ability to track compliance with that rule. So depending on your specialty, the clinical decision support rule that you implement may be different. So for an internal medicine provider, you might implement a rule that says everyone who has an A1C over 8 should come in for a follow-up appointment within 3 months. That type of clinical decision support rule could pop up at the time that you're seeing a patient who has a high A1C score. Any type of clinical decision support rule that's important for your specialty of care, that rule is the one that would need to be implemented. Medicare and Medicaid have not provided any additional information on what type of rule, so you're really open to be very creative and create rules that you think will best benefit your patients. The next item is to implement systems to protect privacy and the security of patient data in the EHR. This rule, as a core requirement, asks you to confirm that your software meets all of the security risk analysis and guidelines. So make sure that all of your users in the system are appropriate. Do they have the sufficient level of user rights? Implement any security updates that are required, and if you find any deficiencies, correct them. The final core requirement, or the final mandatory requirement, is to report your clinical quality measures to Medicare or the states. If you remember, in the past there was a program called PQRI. The PQRI program, when it first started, was about reporting these types of clinical measures. What percentage of your patients who have high blood pressure, what percent of your patients have uncontrolled blood pressure, or what percent of your patients are obese but don't have any follow-up treatments documented, or for your diabetic patients who have a high A1C, how many of them have a treatment plan in place. These types of clinical quality measures are a core part of meaningful use. And the EHR, the MTBC EHR, helps you automatically track those clinical quality measures and submit them to Medicare through your normal medical billing process. It's completely automated, and it also will prompt you when any clinical quality measure applies to a patient that you're currently treating. Now let's shift gears for 1 second and talk about the menu requirements, or the optional requirements in the Medicare program and the Medicaid program. The first one is to implement drug formulary checks. These drug formulary checks are going to provide you an alternative medication list for the time that you're prescribing a medication. So if you go to submit a medication, and we all deal with this on a day-to-day basis, you send a prescription to the pharmacy, and the pharmacy calls you later and says, this medication is not approved by the patient's insurance. Do you mind if I use an alternative? So to prevent those phone calls, and actually to assist the patient at the time of care, implementing the drug formulary, which is an automated part of the MTBC EHR, will provide you alternative medications at the time of prescribing that are based on the patient's insurance. The drug formulary checks that we provide in the EHR give you therapeutic or payer-specified alternatives to the medication that you originally selected. It's an excellent system that also shows you things like the copay amount that the patient might have to pay for this medication. The best time to deliver that information to a patient is when you're actually in the exam room with the patient. So at the time of e-prescribing, the MTBC EHR shows you the drug formulary and allows you to make a choice based on the patient's formulary and on the patient's insurance. So you can choose the Tier 1 medication that's the highest coverage and the lowest copay for that patient. And I think we all know that patients who have to pay less for their medications are going to be more compliant with their medications. And at the end of the day, it's going to result in better course of treatment for that patient when they're able to actually comply with the medication schedule that you provide. The next menu requirement is about clinical lab test results. And here, 40% of your lab results should come in a structured format or a numerical format. And what this means is if you currently participate with LabCorp or Quest or MedLabs or any of the other labs across the country, the MTBC EHR is ready to send and receive orders and results into the MTBC EHR, an extremely efficient and automated system that will stop those faxes that come in on a day-to-day basis. And what's great about having the lab test results incorporated into structured data is that you can later run reports and go find all of your patients who've had a result over a certain value. And what's great about aggregating this data is that you can actually use it later on to do really interesting and exciting things for your patient population. But this is a menu requirement. So if you're not ready to proceed with a lab interface, then you can decide to choose another one of these menu requirements. Again, this menu requirement asks you to choose 5 of these 10 items. And when you choose 5 of these 10 items, you'll be considered a meaningful user of an EMR, any 5 that you choose. The third one here asks us to generate patient lists. Generating a patient list by condition to use for quality improvement, reduction of disparities, research, or outreach. And again, this is based on your choice. You can decide to pull a list of all of your patients who are on a certain medication or have a certain condition. You can decide to pull a list of all of the patients with a certain diagnosis and run that report and then call those patients to come in for a follow-up. Or patients who haven't had their annual physical. You can generate a list of those patients with a specific condition and ask them to come in. So any one, and this menu requirement just asks you to generate one list of patients. So you don't have to do it many times during your 90-day reporting period. You just have to do it once. The next requirement here asks you to use the EHR technology to identify patient-specific education material. So give patient education material for 10% of your patients. The patient education material, if a patient has asthma or hypertension, you can provide them a nice readable handout about their condition that allows them to go ahead and learn more about their condition. You have to provide this education material to 10% of your patients. The next requirement is to perform medication reconciliation between the care settings. Medication reconciliation is going to allow you to see medications that may have been prescribed by other providers. Medication reconciliation for 50% of your transitions of care. So those are patients that come into your practice that may have been referred. Perform medication reconciliation. One of the services that we are certified with for SureScripts is called external drug history. The external drug history allows you to compare the medications actively on the patient list in your system with medications that have been prescribed by other providers outside of your office. These would have to be electronic prescriptions. So any electronic prescription that's been generated for your patient, you can view that prescription directly through the EHR, even if it was prescribed by the cardiologist in Omaha. It's an excellent service that really allows you to see what medications your patients are actually on. The next one here is to provide a summary of care record for patients referred or transitioned to another provider or another setting. So if you're the recipient of referrals from other providers, or if you send a lot of patients out as outgoing referrals, you should provide a summary of the care record for those patients who are transitioned. The next menu requirements are to submit electronic immunization data, so electronic immunization registries. Now, what's interesting about these next two rules is one of these next two rules has to be chosen by your office as part of these menu requirements. So really, you're going to choose 5, but you have to choose one of these 2 rules. And let's talk about them for just a second. So one of them, or the first one I should say, is electronic immunization information. If you're a pediatrician or if you're a provider that provides a lot of immunizations or vaccinations, you should submit your immunization data to the immunization registry in your state or in your locality. Now here, this meaningful use requirement, again, is just asking you to perform at least one test of that submission. In stage 1, that just means submit it one time and test it out. In stage 2, though, this is going to be a constant submission, a regular ongoing submission of immunizations. And we're already assisting providers in those continuing submissions of immunization registry information. So take a look at the electronic immunizations, because you'll have to choose one of these items. If you don't choose immunization information, then the next one, which is syndrome surveillance. Electronic syndrome surveillance should be submitted to the public health agencies in your area. Again, in stage 1, this simply says perform at least one test of that data submission. But what is electronic syndrome surveillance? Here, the Medicare and Medicaid, CMS, is asking about submission of information to, for example, the CDC. You know, how many cases of West Nile virus are there this year? Or if you remember SARS back in I'd say the early 2000s when SARS was in effect, or swine flu as we had a few years ago. This type of syndrome surveillance information, and not just for these rare one-off occurrences of viruses, but there are also other syndromes that public health agencies would require you to submit if you're part of meaningful use. And we have a full list of all of those conditions that can be submitted. Now there are two additional menu items that are available for providers. One would be to send reminders. So here, send reminders to patients for their follow-up care. That would be for more than 20% of your patients who are 65 years or older should receive some sort of reminder for preventative or follow-up care. This could be, again, going back to the previous example, this could be a reminder for anyone who's due for a physical or a Medicare wellness or annual visit, these types of reminders. And what's great about MTBC, and if you choose MTBC as your EHR vendor, one of the great services that we've just launched, and you'll see a press release about it on the MTBC website, is the MTBC Care Coordinator service, so that you can go and have, when you're using the MTBC EHR, we will work with your patients to follow up on these types of reminders. We can make automated reminder calls to your patients who match a certain criteria, if they're over a certain age or have a certain condition or haven't been to your office in a certain period of time. Using that criteria that you set up, we can make automated reminder calls to your patients to come back into the office. And one of the most successful implementations of this that we've done recently was for Medicare wellness visits. For Medicare wellness visits, we called the patients of our clients to remind them that they're eligible for a completely free Medicare checkup that is 100% covered, no copay, no out-of-pocket expense for the patient to come into the office. So not only does that type of service deliver a great reminder to a patient who may need it to remember to come into the office and take care of their health checkups, but it's also a revenue-generating service for the practice as well. These are patients who may not have scheduled an appointment on their own without a very friendly and courteous prompt through this service. So if you choose this item as your menu requirement, MTBC can absolutely help you meet this goal of sending reminders to patients. And the last item here is to provide patients with timely electronic access to their data. What's great about this requirement is that by default, as an MTBC client, this is going to be turned on and available for you. What's nice about the MTBC EHR and the MTBC system as a whole is that we provide a personal health record, a PHR, a patient portal for you and for your practices. One of the services that we deliver to our clients is a full development of a website, a very friendly and attractive website that'll help you be found online by people in your area who are looking for a doctor. So this website that we provide for you is fully integrated with your EHR. When patients register on your website that we've built for you, they'll be able to access things like their lab results, their problem list, their medications, their allergies. They can also access things like their claims. So for billing purposes, they can see what claims have actually been submitted on their behalf. And any outstanding balances that the patients have can also be paid directly through the website. This menu requirement is one of those that are very easy to meet if you're an MTBC client and have this PHR active. So in this scenario, more than 10% of your patients should be provided electronic access to their information within 4 days of it being updated in the EHR. I think you'll be happy to know that when you use the MTBC EHR in combination with the Web Pro and the PHR service, is that it's updated almost instantly. When you see a patient in your office, that information gets updated on the patient portal almost right away. And it's a really exceptional service that's really helped patients engage with our offices and our clients. When patients can communicate with you through a secure portal, if they can self-schedule their appointments on your website, if they can log into your website to access their lab results or request medication refills or view any scanned documents that you send them, they're going to be much more engaged with your practice and engaged in their own healthcare and in their own treatment plans. So this is a really great service that, yes, even though it's part of meaningful use and it's part of this incentive, it delivers an exceptional result for your office as well as your patients. Now, beginning meaningful use with MTBC and actually completing meaningful use with MTBC is less intimidating than you might think. It's a very easy project when we start talking about the support that MTBC provides. Through the MTBC EHR, you have a full meaningful use calculator that's going to show you all of those measures that have been successfully met and those measures where you're still missing some information. Taking a look at this calculator, when you run it through your EHR, you'll be able to see all of those 15 measures that we talked about, those core requirements, these core requirements here. You'll also be able to see the menu requirements here, and you can track the success of each point of these requirements. You can see the total numerator and denominator. These are numbers that you'll have to submit when you go through the Medicare attestation. You'll see the actual value of what numbers you've met for each individual requirement and what the required value is for those items. On the right-hand side of the screen, you'll see a button for a video demo. In the MTBC EHR, you're able to actually watch a video on each and every one of these requirements to see how it is specifically met through the MTBC EHR. This video demo is going to show you all of the actual things you have to do, step by step, to meet those meaningful use requirements. One of the other things that you can do is you can click into any of these details buttons. So you'll see this details button next to every one of those meaningful use points. When you click into the details button, it's going to show you the actual maintain problem list screen for your patients. So here, if we go back 1 second. So here, for maintain problem list, I can see the total numerator and denominator, the percentage calculated, and the required. If I wanted to, I could double-click on any one of these patient accounts to open up that patient's record. There I can enter the actual diagnosis or problem for that patient, save it, and come back to the meaningful use calculator. And when I do that, those numbers are going to be updated with the information that I've just entered. So the meaningful use calculator through the EMR is going to show you everything that you need to do in order to qualify for meaningful use. And it tracks your performance throughout the entire process. Let's go ahead and talk about this Project October that MTBC has launched. Well, you're here today, June 20th, attending a webinar about meaningful use. And hopefully by tomorrow, if you haven't already done so, you can choose MTBC as your EHR and as your revenue cycle management service. One thing that we'd want to do with you, and one thing that we actively do with all of our clients who are interested in meaningful use, is we're going to assign you a meaningful use coach. So from the time that you start with MTBC, if you're already in the pipeline for meaningful use and you're interested and you tell us, I'm ready to start with meaningful use with MTBC, you're going to be assigned a full-time meaningful use coach for your practice. That meaningful use coach is assigned to your account and is going to help you throughout the entire meaningful use reporting period. The MTBC coach is going to run with you those reports that we just looked at, the meaningful use calculator, once a week on a regular review and a regular audit of your account to talk about what are the items that you're still missing, where are you still faltering, and what are the things that you have to do to meet your goals. So that meaningful use coach will be assigned to you right when you get started and right after you choose MTBC as your EHR. On July 1st, if we look at a project plan to meet our meaningful use goal for October 3rd reporting period, this is a sample plan that we've put together. So if you implement the MTBC EHR on July 1st and have it installed and set up and configured, any hardware that should be purchased should be done now, between now and the time that it's implemented and set up. We'll train you on the MTBC EHR in the first or second week of July. The first step that we'd want you to do is begin scheduling on the MTBC EHR. Scheduling is one of the easiest things you can do to actually begin using the software and get familiar and get your staff up and running. So take a week or so to start scheduling on the MTBC EHR. Get your patient data imported by our IT group on your software. Let's go to the next section. How do I get rid of, okay. To clear, okay, erase, sorry about that. So learn to use the EHR, begin scheduling on the EHR. The next important step would be to have your nurses begin entering vital signs and some clinical information into the EHR. You can do that in July. So you take 1 week or more to begin scheduling on the system. Then the next step would be to have your nurses or your medical assistants begin entering clinical information, vital sign information into the EHR. And by that time, your staff would already be up and running with scheduling, insurance eligibility, chart creation, and so on. The next step would be for you as the provider to begin e-prescribing. We saw that that's one of the most important items that's part of meaningful use is the actual e-prescribing. Beginning e-prescribing, even for a handful of patients or just new patients, will take you dramatically closer to achieving your October 3rd deadline of beginning your meaningful use registration and attestation. The next step would be on August 7th to begin your ICD and CPT entry. So those are the diagnosis codes. Those are the procedure codes, selecting the active diagnosis code list for your patients. Do that on August 7th and you'll be well in line to begin your meaningful use attestation. On August 14th, you can work with MTBC staff to edit and modify and customize all of your templates. And in fact, this is something you could even do well before you begin e-prescribing or scheduling. When you're assigned a meaningful use coach with MTBC, that coach can help you customize the EHR, to have your templates, to have your forms, to have all of the information that you need to actually begin using the EHR. And if you start in September entering clinical documentation, those are the history of presenting illnesses, the physical exams, the review of systems, your plan of care with patients. If you begin entering that information in September, then you'll be well on your way to be fully up and running and functional by the time that October 3rd deadline comes around. As we discussed, October 3rd is the last day to begin your 90-day reporting period. I'm confident that if you were to get started with MTBC now or in July, you'd be ready to submit your meaningful use attestation well before the October 3rd deadline. December 31st of this year is the last day to be part of your 90-day reporting period to earn the full $44,000 the full $44,000 Medicare meaningful use incentive. By that time, you would have already submitted your meaningful use attestation and, like our happy clients here, you would earn your check. Now, MTBC can help you achieve meaningful use in a number of ways. Our EHR is fully included with our 5% revenue cycle management plan. If you're already an MTBC client and you're not using our EHR, we're ready to help you get started. And any issues that you might have, you can definitely get up and running with our technical support and our EHR team right away. My contact information is at the end of this presentation, and I welcome anyone to contact me to set up or help them get started on this path, if you're an existing MTBC client or if you'd just like to learn more. The benefit of using our EHR over our competition is that there are minimal hardware requirements. There's almost no type of computer that the EHR cannot run on. We run on PCs and Macs. You can access your EHR remotely outside of your office, and we are now launching our new web EHR that's fully web-based and runs in your browser. Our EHR is fully integrated with all of the services that you need for meaningful use, and there's never any additional charge. It's just part of the 5%. For e-prescribing, insurance eligibility, the personal health record or the patient portal, lab integration, and so on. Our meaningful use coach, the coach that's assigned to you, is going to help you with all of your government or health agency reporting, whether it's immunization registry or syndrome surveillance. And it's 24/7 completely free technical support. And we try to resolve items on the phone when you call. You don't create a new ticket, you don't create a new order, you don't have to call back or wait for someone else to assist you. Our technical support is exceptional, and they help answer questions while you're on the phone. All of these services are just part of the total package that is available from MTBC. As part of that 5% plan, we are going to set you up with the lab connectivity and the full e-prescribing. We have apps for the iPhone and Android and iPad that allow you not only to prescribe medications, but also to access your full clinical note. All of the information you enter in discrete data elements in the MTBC EHR is available to you through the iPhone and Android apps. And you can look those apps up right now in the App Store. Just look up MTBC and you'll find apps for e-prescribing and chart lookup. You'll also find a brand new app that we've just launched that's actually part of the WebPro or the PHR service. The new app that we've just launched is for the MTBC PHR. It's the patient portal app. So your patients today can download an app on their smartphone that allows them to communicate with your office, look up their patient health information, access their medication list, view any scanned documents that you send. It puts the power of our website in your patient's hands, and it allows them to see all of their health information and have it with them wherever they go. All of these services, including the appointment reminder calls and the patient education service and the website that we build for you, they're all part of the same 5% package. 5% is our fee for our service, our full service. 5% of your collections will provide you access to the MTBC EHR, the full meaningful use coaching, and the support throughout your reporting period and the submission and attestation to Medicare. All of these items together are provided at that low rate so that we can help as many providers as possible improve their delivery of patient care and also improve their engagement with their patients. Now is the time where if you have any questions, and there have been many questions submitted on the GoToMeeting panel. So if you have any questions, you can begin by, or if you haven't already asked your question, you could submit your question through the right-hand GoToMeeting panel on the right-hand side of the screen, and we will try our best to answer them. So if you give us 1 minute here, we'll go through some of these questions and begin answering them. If you have a question to ask, go ahead and submit that question. By the way, this webinar is being recorded and will be available on the mtbc.com website either by tomorrow or by Friday, available for you to view later on. And any questions that we're unable to answer will be answered to you by email. So at this time, please go ahead and submit your questions and let us take a look quickly at this questions list and begin answering them. In the meantime, my contact information, again, this is Mohammed Shabli with MTBC. My contact information is on the screen. I welcome you to email me or give me a call directly if you have any questions. If you're not currently an MTBC client, you can reach out to me directly, or you can contact our sales team. We'll be more than happy to set you up with a completely free 90-day trial of the MTBC EHR, completely risk-free trial of our software, and also help answer any questions that you might have about our software or our system. So give me 1 second here. I'll go ahead and take a look at some of these questions and come right back on the line ready with your answers. Okay, the first question that we have is from a podiatrist who's asking for the registration, or excuse me, these menu requirements, and let me just go back to that page for a second. The menu requirements about electronic immunization and electronic syndrome surveillance. Well, what if you don't meet either one of those requirements? What if you don't fall into a category that has immunizations or has syndrome surveillance? Well, in that scenario, you can get an exclusion from the requirements. There are many of the requirements on the meaningful use on this meaningful use list, whether they're core requirements or menu, allow you to be excluded if they don't require or if they don't have any impact on your specialty of care. So if you don't provide any immunizations or vaccinations, and really the syndromes that you might have in your office are not going to be reported to public health agencies, then you would either have an exclusion from the requirement, or if there is no exclusion for that specific requirement, then you can simply submit a 0. So if there are no syndrome surveillance items to submit as a podiatrist, then you would simply submit a 0 for that specific item. And many of these were written in keeping in mind that there are providers who are going to be excluded. One of the great things that you can do if you go to the MTBC website is you can access all of these, the actual rules for each one of these requirements. So let me pull this up on the screen here. The MTBC.com website, you'll find a lot of great information about our software and our service. But if you go to our resources section and you click on demos, you'll see each of these meaningful use requirements listed. Each of these meaningful use requirements, the requirements that we just covered today, you can click on a PDF to open a PDF about that specific rule, and you can read that rule as it was written with all of the distinct details that were provided by Medicare and CMS. So you can click into that objective, read the entire details of that rule, and see if there are any exclusions. Now, many of these do have exclusions. For example, here, there's an exclusion for any provider who writes fewer than 100 prescriptions. This is for the CPOE, or the computerized provider order entry requirement for medications. So any provider who writes less than 100 prescriptions would be excluded from this entire rule. So if you have any questions about the individual rules that we looked at today, go to the MTBC.com website, resources, and then click on demos. So not only can you read that rule, you can also click here to watch a great video on how that rule is met through the MTBC EHR. And these videos are the same ones that are integrated with the MTBC EHR's meaningful use calculator that we looked at earlier. The next question that we have is about the demographic entry. The demographic entry, does it have to include all of those requirements for every patient? Well, let's go to the demographic entry. That was one of the core requirements. Record patient demographics, sex, race, ethnicity, date of birth, preferred language. All of those requirements have to be entered. So it's not enough just to record date of birth, gender for your patients. You also have to get ethnicity, preferred language for at least 50% of your patients. So for 50% of your patients, each of those 3 components has to be entered. Those components, all of them together, so you have to have all 5 for 50% of your patients, not 50% for race and 70% for gender and so on. No, it's 50% meeting all 5 of the requirements. And the vital signs works in the same way. Height, weight, and blood pressure have to be documented. I don't mention BMI here because BMI is automatically calculated when you use the MTBC EHR. So the BMI is automatically going to be documented. You don't have to calculate it yourself. You do have to enter height and weight and blood pressure, but you don't have to enter BMI because it's automatically calculated. Any growth charts that you would provide, the MTBC EHR has growth charts for newborn patients up to 20 years old. So you can provide any growth charts for your patients from that way. Okay, great. The next question that we have is about the meaningful use coaches and how they help with practice. What exactly does a meaningful use coach do? So our meaningful use coach is going to schedule a weekly call with your office at a time of your choosing, at your convenience, and is going to work with you to audit the meaningful use calculator. So every time the meaningful use coach gives you a call, they're going to review this entire meaningful use calculator with you. And this meaningful use calculator is by provider. So if you look over here, there's a provider choice for this list. If you remember, the Medicare or Medicaid plan is by provider. So each provider in your practice will have to have this follow-up call with the meaningful use coach, or you can run the report on your own. The benefit of having the meaningful use coach with you is that when they see things like your documentation of vital signs and smoking status is so low, they can jump on that with you, and they can talk to you about how to improve the documentation, share with you some of the things that they have seen with other providers, and answer any questions that you might have about how to document it. So the meaningful use coach is going to have a weekly audit with you throughout the entire 90-day reporting period. They can talk they can talk to you about the individual plan that they can customize for you, just like that timeline, the October project timeline that we looked at earlier. Our meaningful use coaches develop a plan specific to your practice based on your needs, and they can help you go through each of the individual steps until you're finally submitted and finally reached your meaningful use goal. And in fact, we help providers register on the Medicare and Medicaid website. The registration process is web-based, and the attestation process is web-based, and we can help you throughout that entire plan, from the time that you register until you've actually received your check. There's a question here about, are there additional fees for the services that we talked about, PHR, appointment reminder calls? No, there are no additional fees for any of the services that we've talked about. The services that I mentioned on the value-added services slide, these are all included as part of the 5%. The only one that might have an additional fee is if you choose to purchase a kiosk. A kiosk is a computer that sits at your front desk that allows patients to check in electronically at a touch screen. It allows patients to pay their copay with a credit card, scan a copy of their insurance card as well. It takes a patient picture, which gets implemented or uploaded into the EHR. So if you want the kiosk, there's a hardware purchase from our hardware vendor. It's about $1,700 for the basic configuration. And if you get a bigger screen or additional components, it can go up to $2,000 or $2,500, depending on what you order. But that's just a hardware fee from a third-party vendor. The support and the software that runs on that kiosk, there's never an additional charge for that. The services that we covered earlier of the PHR, the e-prescribing, the lab connectivity, everything is included at just 5% of your collections. When you choose MTBC, you get a fully integrated package, get a fully integrated service that meets and provides all of these tools and services that we've talked about. And we've arrived at the 2 o'clock hour, I should say. This is the end of this webinar. The questions that were asked that I was not able to get to, I do sincerely apologize, but I will contact you by email to answer your questions. And your telephone number, if you provided it at the time of the GoToMeeting registration, we can also reach out to you by phone. Please take a moment and write down my contact information. If you have any questions or if you'd like to contact our sales department, feel free to write down their number as well. I really want to thank everybody who's attended this webinar. And again, this webinar, like all of the other webinars, is going to be available on the MTBC website for later review. And if you have any questions, again, please don't hesitate to give me a call. Thank you very much.